Hi, it is Tuesday, March 24th. My name is Dr. Regina LaRocque. I'm a board member of Sustainable Wellesley. I am a infectious disease physician, researcher, and specialist at Mass General Hospital. And I am also a member of the Natural Resources Commission in Wellesley. I am here to represent myself, and I have been providing some information to the community about the ongoing coronavirus epidemic in Massachusetts. And I wanted to take this opportunity to read a letter to Governor Baker that I, along with 300 other physicians, have signed and have delivered, or is going to be delivered to the governor. And I think this is important information for everybody in our community to be aware of, so I'm just going to read the letter. Dear Governor Baker, thank you for taking a step yesterday by closing non-essential businesses in the Commonwealth of Massachusetts to protect public health and safety and to combat COVID-19. We, the undersigned, are a diverse group of Massachusetts physicians with expertise in emergency medicine, infectious diseases, surgical and medical specialties, public health, and primary care. We practice in world-renowned hospitals, safety net hospitals, community hospitals, and ambulatory centers. We are working hard to combat this pandemic, but we are calling upon you, Governor Baker, to take action now to protect the lives of physicians and healthcare workers across the Commonwealth. The ongoing rates of community transmission and the severe shortage of personal protective equipment translates to physicians being asked to choose between their own lives and those of their patients. No one would imagine sending firefighters into a blazing fire without proper clothing and equipment. But our physicians, nurses, and other healthcare workers are being asked to treat COVID-19 patients without protective gear. Hospital policies regarding PPE access vary across the Commonwealth and can be perceived as practical decisions based on available resources, which raises fears about safety and profoundly undermines morale. Some physicians report having no access to protective gear. Some physicians are making heart-wrenching decisions to live apart from their children and spouses due to fear of infecting their loved ones with COVID due to inadequate PPE. Can we imagine asking hundreds of thousands of firefighters to make their own homemade fire protective gear before combating the fire they are running into, and essentially spreading that fire to their homes? We urge you to mobilize leaders of corporations and community organizations in a warlike fashion across the Commonwealth to halt community transmission and to produce, purchase, and provide PPE. We ask that you join forces with other governors and state officials to sound a clarion call across the United States. We cannot and should not wait for the federal government. Here is what we need. 1. Please communicate clearly that all public gatherings of any size are prohibited. Without this step, our healthcare system may collapse within 8 days. Cases of COVID-19 are continuing to double every 2 to 3 days. Work with other governors to institute a true national 2-week pause, a cessation of all non-essential activities. If all of us across the country simultaneously distanced ourselves from one another for at least 2 weeks, community transmission would slow down significantly, allowing time to produce, purchase, and provide essential personal protective equipment to our physicians and healthcare staff. Number 2, personal protective equipment needs to be equitably delivered immediately to all physicians and healthcare staff to allow each employee caring for patients reliable access to hospital-grade N95 masks, ear loop masks, face shields, and other essential protective gear. We call on 3M and similar companies to halt production of all other products to focus on PPE manufacturing, N95 and other masks, gowns, gloves, face shields, and eye protection. We call upon plastics manufacturers to focus on production of protective gowns, face shields, gloves, and other medical items. We call upon companies like Amazon, courier companies, and USPS to focus on delivering the PPE to the healthcare force. We ask that the National Guard be called upon to help with delivery of PPE to healthcare workers. We urge philanthropists and corporations to donate money to purchase or manufacture these items from citizens who are hoarding them and from companies around the world. We urge Procter & Gamble and similar companies to focus on hand sanitizers, soaps, detergents, and disinfectant wipes. These products are critical for washing and disinfecting hands, hospital scrubs, gowns, linens, and hospital surfaces. We urge you, Governor Baker, to work with other governors to pressure the president to immediately use the Defense Production Act to increase the domestic production of medical supplies and equipment. Number 3, to defeat the pandemic without freezing the economy, widespread, easily accessible COVID-19 tests need to be available immediately. We need to perform at least 2,000 tests per day in Massachusetts to understand community transmission. Currently, we are performing approximately 1,000 tests per day. We need to establish COVID-19 testing centers organized by infectious disease and public health experts, available for asymptomatic people as well as symptomatic people. This will enable us to understand where community transmission is occurring and avoid spreading the infection through our healthcare system. We urge you to include experts in infectious disease, pandemic preparedness, and public health, as well as frontline clinicians in your command center, embedded in your command center. And we ask for transparency surrounding these advisors. The surge in the number of critically ill patients will increase demand for crucial life-saving medications and treatments, and these experts will help you mobilize appropriate biotechnology and manufacturing companies to ramp up production according to needs. Massachusetts has a wealth of experts and innovative minds who lead global corporations and institutions. Collectively, we can solve this crisis. Every day that you, Governor Baker, delay results in a doubling or a tripling of loss of life. More people could die from COVID-19 in just a few months than have died in every single war this country has fought since its inception. We urge you, Governor Baker, to take immediate action to harness the power of the Commonwealth to protect the lives of our physicians, healthcare staff, and their families, and the lives of current and future patients. I'm joined by more than 300 other physicians in this letter, which is presented today to the COVID command team. We call on Governor Baker to respond to our requests.